Good morning. It's your daily dose of complete health with your local chiropractor, Patrick Hogg. Why do we always wait? As the old saying goes, an ounce of prevention is worth a pound in cure, which I believe was quoted from Benjamin Franklin. And it's one of my favorite quotes. An ounce of prevention is worth a pound in cure. And the thing is almost all of us know that this is true, especially when we start looking at stuff like our houses and our cars and all of these other things where we could just make a very small change that would create a compounding effect that stops damage from occurring. What the example always used is if you had a leak under your sink, you wouldn't wait until the pipe blows because the water damage that would start to create would cost you a lot more. However, when we start looking at people's health, we don't necessarily look at this the same way. And when I speak to a lot of my clients, we're definitely not the first choice. Let me say that again. We were definitely not the first choice. Many people that will end up in my office will have gone through countless appointments or attempts of appointments with their doctors and have had to wait extensive periods of time to try and find out what the problem is, only to find out that their time has been wasted or their referral has been lost or the therapy was a duff or they finally got to a physio and all they got was a sheet of paper with a list of very generic exercises that you could have looked up on Google. Now, I'm not necessarily saying that chiropractic is the only thing that should be considered, but healthcare should be considered as a primary option, especially when we start looking at physical injuries and mechanical injuries. The first thing should always be considered is physical therapy. Why? Well, the risks are almost zero. There's almost zero risk unless someone has got a serious condition that needs surgery immediately, e.g. they've got a torn bicep or a torn Achilles. Those kinds of things would warrant surgery straight away, but generally as a rule of thumb, almost all mechanical injuries, anything from low back pain to disc pain to sciatica, is not necessarily immediately considered a surgical emergency. And so as a result, a lot of us are looking for quick fixes or quick options and cover-ups which don't necessarily solve the problem. And instead, we end up finding ourselves in a rut. Now, interestingly, I've got a few clients over the last couple of months that have got quite serious low back and leg pain as a result of having surgery. Now, it's not the first time that I've had clients with low back injuries that have had discectomies that actually make the problems worse. So the solutions that are offered to them, and once we've gone down those roads, it is very difficult to then get someone back, because once a part has been surgically removed, we as chiropractors cannot necessarily help that tissue to recover and restore. So if someone has blown a disc and it's bulging and it's pressing on a nerve and they take it out and then the sciatica comes back, the likelihood is that now that bone is impinging and not the disc. And this, unfortunately, becomes one of those problems that people can't always fix. So just be aware that if there's a problem that you've been off-putting, or there's a problem there that hasn't been checked because you're being thrown around, maybe consider chiropractic, physio, or massage, or anything that osteopathy, anything. Just do not wait until the problem becomes a bigger problem. And like I say, at the moment, my experience is with clients, they're getting frustrated in the NHS because the waiting times have become extortionate. This is your daily dose of complete health. If you need any advice, or maybe you're wondering whether we're right for you, just leave us a message and we'll try and get back to you ASAP. Take care for now. Speak to you soon. It's very annoying, the long times, and not always getting the treatment that you need. Thanks, Cheryl, for sharing. Take care. I'll see you soon.